Good afternoon. Thank you for tuning in to the Government of Newfoundland and Labrador's COVID-19 News Conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today is Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Are the most effective way to prevent the spread of infectious disease, but developing one can be costly, long, and complex. However, with significant investment and collaboration at a global scale, developing a vaccine is possible in a much shorter period of time. So how are vaccines developed today? And will the development of a COVID-19 vaccine be different? All vaccines go through three basic stages of development: the exploratory stage, the preclinical stage, and the clinical stage. In the exploratory stage, scientists do basic laboratory research to find vaccines that can help us develop immunity to a disease before being exposed to it. On January 11, 2020, the genetic code of the virus causing COVID-19 was published. This allowed scientists all over the world to start working on finding potential vaccines. With more than 150 in development worldwide, scientists are using current approaches like using whole or parts of killed or weakened virus, and newer techniques such as delivering COVID genetic material directly into cells. In the preclinical stage, scientists use laboratory and animal studies to identify safety concerns before testing the vaccine in humans. It is also used to help find the safest dose. While many vaccine candidates don't progress beyond this point, successful ones move on to the clinical stage, where they are first tested in humans. This stage normally consists of three phases. Phase 1 trials involve a small number of healthy volunteers to test safety and confirm that the vaccine causes an immune response. An immune response refers to how our bodies recognizes and defends itself from viruses and other potentially harmful substances. Promising vaccines then progress to Phase 2, where they're given to hundreds of participants, including groups at risk of the disease. The goal of Phase 2 is to test the vaccine's safety, the proposed doses and method of delivery, and again, to assess the immune response. Phase 3 studies involve thousands of volunteer participants and compare groups that received the vaccine to those that didn't. These studies are used to further answer whether the vaccine works and still demonstrate that it's safe for use. One way scientists have worked to reduce the time to develop a COVID vaccine has been to use study designs that allow merging of clinical phases. For example, new approaches have allowed for Phase 2 participants to be included in larger Phase 3 studies, allowing scientists to shorten the overall timeline and number of participants needed, without cutting corners or compromising safety. The first COVID-19 vaccine trials in humans started in March of 2020. Since then, tens of thousands of volunteers have been enrolled in clinical studies worldwide. Health Canada, responsible for regulating the use of vaccines in Canada, has authorized clinical trials for COVID-19 vaccines. Before approving a new vaccine, they look closely at all the data on it, paying very close attention to its safety. Many vaccines will fail somewhere along this path if they don't work or are unsafe. It's normal, and this is the purpose of all the stages of development and clinical trials. Only those that are proven safe, effective, and of high quality will be approved for use in Canada. A safe and effective vaccine will bring us one step closer to the widespread and long-term management of COVID-19. When a vaccine is ready, Canada will be ready too. Visit canada.ca/coronavirus to learn more.
Good afternoon, everyone. Thanks for joining me today. Just want to start with an update. We have 4 new cases in the province today, all in the Eastern Health region. The first is a male between 20 and 39 who returned from international travel. Contact tracing is completed in this case. We also have 3 new cases today, which are all connected to a case announced yesterday. They include 1 male and 2 females, all between the ages of 20 and 39. This brings our total cases to 404, and 9 of these are active. Public health staff at Eastern Health have been diligently working over the past 24 hours to complete contact tracing, quarantining, and testing. To date, we have not been able to identify a source for this cluster. This is therefore a non-epidemiologically linked case. And these types of cases are worrisome because they can indicate wider community transmission. And while we are not ready to make that determination at this time, it will involve extensive traceback and investigation to identify the source. There is a suspect case associated with a daycare, and public health officials have been in contact with the daycare to advise that all staff and children in the suspect cases cohort must quarantine for 14 days. There are no positive cases in the daycare at this time. Testing will be completed in accordance with our case and contact management protocols. All parents and guardians have been notified at this time, and public health is following up with the families. The investigation is ongoing, and officials are working on contact tracing to try to identify the source. Based on the date of initial symptoms, the source contact could have been as far back as New Year's. This is a reminder that COVID can raise its head anywhere at any time, and we must not let our guard down. Remember to keep your close, consistent contacts to 20 or less. Informal gatherings can be no larger than 20 individuals and only as space permits. You should only attend a gathering with your close, consistent contacts. If you find yourself in a gathering with individuals who are not in your close contacts, you should maintain at least 6 feet of distance from others. Remember the phrase, people, space, time, and place. The more people you interact with, the greater the risk of spread. The closer you are to others, the greater the risk of spread. The more time you spend with others, the greater the risk of spread. And indoor activities with others are more risky than outdoor activities. Stay vigilant in applying your layers of protection, particularly when you are in public places or other people's homes. Wash your hands frequently with warm water and soap for at least 20 seconds, or use an alcohol-based hand sanitizer in the absence of soap and water. Wear a non-medical mask in public indoor spaces. Maintain physical distancing. Practice proper cough and sneeze etiquette, and if you are sick, stay home and avoid contact with others. If you have symptoms of COVID, please call 811 or complete the online self-assessment to determine if you need testing. If you are unwell and have tested negative for COVID, you should still stay home until 24 hours after your symptoms have passed. An accurate test result depends on viral load, which is the amount of virus in your body. Sometimes it takes a few days for the viral load to build up enough for the test to detect it. If the swab is taken early in the course of the illness, it could be a false negative. So a negative test is not a guarantee. If your symptoms persist or worsen, please recheck to see if you need retesting. We have seen individuals taken off guard by a positive test after initially testing negative. If you have not done so, please download the COVID Alert app. This app helps public health in contact tracing and will alert you if you are a close contact of someone who has tested positive. If you have the app and you test positive, your close contacts will not be notified of your identity. Above all, please be kind to one another. No one sets out to contract or spread COVID. They may have done all the right things, taken all the recommended precautions, and the virus still somehow made its way through. So blame the virus, but not the person. Today is Bell Let's Talk Day, and there is no better time for us to put ourselves in another's shoes and consider how they may be feeling. This pandemic affects so many people in many different ways, be they a friend or a stranger, someone who tested positive for COVID, an individual that has returned from working away, or a senior who is feeling alone and isolated. We are all in this together. So choose kindness, choose compassion, and hold fast. Thank you. I'll now turn it over to questions from the media. Leslie?
Thank you, Dr. Fitzgerald. There are 6 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, I'm wondering if you could tell me about the nature of the contact between these 4 cases that we're seeing here. Are these people who work together, live together? How do we know? What do we know about how the virus has spread between them?
So these people were relatively close contacts with one another. Some were household contacts, some were work contacts. So, but relatively close contacts on the whole.
And when you say one of these cases involves a daycare, can you give us a little more detail in terms of what is the connection with the daycare and which daycare are we talking about?
So I can't really release the name of the daycare. From a privacy point of view, I don't want to risk the chance of the person being identified. And I certainly can't speak to the nature of the case itself, other than to say that it's a suspect case that is associated with the daycare.
Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Can you tell me or tell us again what the precautions that are going ahead with the daycare involved, and how long those precautions will be in place?
So the members of the cohort of the suspect case have been asked to isolate. So that's staff and children. And presumably the daycare will have a cleaning process in place that they're instituting. And then the contacts or the cohorts, will be tested as per our protocol. So depending on testing results of that suspect case, we'll determine whether we test now or if we wait a couple of days to test those people.
And I might have missed at the beginning, did you say that a child is one of the cases?
No, I didn't say a child was one of the cases. I just said there was a suspect case associated with the daycare.
Okay. Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. In terms of the daycare, why not, I know that the cohort is isolating, why not have the entire daycare shut down as a precaution?
So the whole point of instituting cohorts at the beginning of all of this, when school went back, we did the same thing in schools, is so that we could maintain schools or daycares to be open so that the cohorts were separated enough so that if there was a suspect case or a case in a cohort, then we could have the rest of the facility remain open. And so, if the daycares have been following that, and to the best of my understanding, they have been following that well, so then there's no need to close the whole facility.
And Dr. Fitzgerald, you mentioned that one of the source of this case could date back as far as New Year's, I believe you said. I was wondering if you could give us an idea of the scope of testing in this situation. How many people have been tested to date, and do you anticipate a significant amount more left to test?
Yes, so there have been quite a number of tests. I don't know the exact number at this point because Eastern Health is carrying out that on-the-ground investigation, and that number is changing as we speak, I think. But certainly, there's quite a number of people in isolation, and all of those will be tested. And we may, depending on what the traceback for the source reveals, we may end up having quite a bit of testing that has to happen. And there could be some advisories with regard to people being in certain places for testing as well.
Thank you.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. We understand at least one retail store closed early yesterday, and contact tracing is underway for patrons of a restaurant. So how many businesses may be affected affected by these new cases?
So all of that information is certainly being worked through right now by the staff at Eastern Health. So we certainly, I don't have a definitive number for you at that, and of course that will change depending on the number of contacts that we identify or the number of contacts that end up testing positive. So, it's difficult for me to say just yet because the investigation is so new and really just getting underway.
Thank you. And since mid-March, I'm curious, how many instances of community spread or suspected community spread have been recorded?
Do you mean non-epi-linked cases?
Yeah.
So I think this is either number 7 or number 8.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Are any of these cases popping up as a new variant that we've heard about through other parts of Canada?
So certainly we don't have that information at the moment. The only way we know if it's a new variant is if we have something called whole genome sequencing done, and right now that has to be done at the National Microbiology Lab in Winnipeg, so all our samples would have to be sent off. If we had concerns that that was the case, certainly we can get a quick turnaround time. At the moment, we don't really have any indications that that is the case, but as I said, it's still very early in the investigation.
Thank you. And I know it was talked about a retail store and how these are generally close contacts from household or work. Does it look like public health will be putting out advisory about their movements, as in they were at this grocery store on this date or things like that?
So I think what we have to remember with this, what we're trying to do right now is to find the source of these cases, right? So what is, where did this virus come in from? And somebody had to bring it in, right? So as we trace back, then what we may find are places where there may have been a potential source. And so when we're asking people to go out and get tested, that's really what we're looking for, because a lot of this, so much time has passed that there's not necessarily a danger in that place right at this moment. It's more about having people who were there get tested to see if we can find that source. So it's really important if we do come out with advisories, and I suspect we probably will, that people do take heed and go and get tested if they were in any of these places.
Thank you.
Our next questions are from Maud Montembeau from Radio Canada. Please go ahead.
Bonjour. I would like to know if the traveler was coming from another province or another country, and has he been isolated here?
Yes, so the traveler was traveling internationally, and they have been isolating since they returned. So all contact tracing is completed in that case.
Do you think that more federal measures would have helped prevent this case, or
no?
There's no link.
No. This is no, federal increased measures wouldn't have prevented this case.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
We've seen a couple other sort of clusters back in the fall where we initially had non-epi-linked cases, and then we, had to do some tracing and eventually trace back. How does this one compare to those? Are you more or less concerned about this than you were about some of those? I'm thinking, the Burin Peninsula, the Deer Lake cluster, things like that.
Anytime we have a non-epi-linked case, we're concerned. Certainly on the Burin Peninsula, we were concerned because there were a lot of elderly people that were involved in that little cluster, and certainly that's always a concern with this virus, as you know. But anytime we have non-epi-linked cases, we're always worried because it can be that indicator, it can be the canary in the coal mine, right, of wider community spread, which we want to, if it is there, we need to find it, obviously. So that's why we're putting so much effort in at this point to try to find that source.
You said the case with the daycare is a suspected case. Is that one of the now 4 that have been announced, or is this someone else who you suspect but hasn't tested positive?
Yeah, the 4 that have been announced have been confirmed with positive tests, and a suspect case is a case that doesn't have a positive test, but may be linked somehow to a positive case.
Okay.
Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Yeah, I'd like to follow up a bit on what Peter just asked. In the Harbour Britain case, that was eventually linked to travel, but the contact tracing, you had to basically take a deep dive to go back that far. Has that process already started in this case?
Oh yes, yes. There's all cases that have been identified are doing a really deep look back in the 2 weeks prior to becoming symptomatic to see where they were, who they were around, to see if there was a potential source of an infection, as well as the contact tracing that has to happen for each individual to determine when their infectious period was and to identify any contacts who may be exposed from the case themselves, right? So there's 2 directions for contact tracing. There's contact tracing that happens to prevent forward spread, but then there's that backward trace back that happens to try to identify the source.
You said earlier that these cases could originate as far back as New Year's Day. Is that because we're literally 2 incubation periods out from New Year's Day now?
No, so what we do is look at the initial onset of symptoms in the earliest case, or the case that had the earliest onset of symptoms, and then we'll go back 2 weeks beyond that, right, which is the incubation period.
Okay, thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. With this new cluster, do we anticipate having to tighten any restrictions in the area?
I think that remains to be seen. We certainly said, if we get into a situation where we're seeing widespread community transmission, we would have to take measures to make sure that we reduce that. But we're not there yet. We're certainly in very early days of this investigation, and so we have to see what we can find, and we have to let Eastern Health do their job, and they've proven to be quite good at doing this in the past. So we'll have to wait and see what happens first.
We're in the middle of an election right now. Do you anticipate that this cluster could affect the election process in any way? And do you advise that candidates take any extra precautions now as they're going around doing their campaign?
So I would advise candidates to take the same precautions that we've been advising all along, and that's to keep your close contacts as low as you can, and to physically distance and wear your masks and wash your hands and all that. So that's certainly something that people need to consider, and avoid large gatherings, and so all of those things I think will continue. But with regard to it affecting the election, I don't know. I mean, this is COVID. This is what COVID does, and we've been saying all along that we have to expect that COVID can pop up anywhere and that it can happen, and so I don't think this cluster now and COVID doing what COVID does should affect an election.
Thank you.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. When these non-FEU linked cases happen, how much of public health resources are gobbled up investigating into it?
There's a fair bit of public health work happening right now. We have several nurses who are on this and who are doing the investigation, doing the contact tracing, notifying people, arranging testing. So there is a lot of work. And we have about 90 people right now in isolation, so that's not insignificant.
Right, and with this situation still ongoing, still developing, will we get another COVID briefing tomorrow?
Certainly, if there's anything new to share, I'll be here to do a briefing. Yep.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. I just wanted to follow up on my previous variant question. How long approximately does it take from leaving the province to go to Toronto for us to receive the results on that.
Sorry, leaving the province. Oh, to go to Winnipeg, you mean?
Yes, sorry, Winnipeg, not Toronto.
Yeah. So we, generally speaking, if it's urgent, so we send many of our positive results for whole genome sequencing. So we have been doing that surveillance all along. But if we need something done urgently, we can get the results usually within 72 hours. But weather at this time of year can have an influence on that.
Are still living on the island. How important was it for you to hold this briefing today to get ahead of this, to reassure the public?
Well, I mean, that's part of the reason why we did want to get out here. We knew that people would probably have questions. Social media seems to beat us every time getting news out. But so we wanted to make sure that people understood what was happening, that public health does have control of the situation, or at least a handle on a situation. They know where they need to go with this. They've already, delineated the path that they have to take. They're working diligently. They have lots of people on this. But I really want to encourage people that if you have symptoms that are consistent with COVID, so if you have a cough or a fever, and you only need to have a cough or a fever, you can get tested for COVID. And then all of our other symptoms like, runny nose, sore throat, difficulty swallowing, loss of taste or smell, nausea, vomiting, diarrhea, those sorts of things. Those symptoms are all on our website, but if you have any two of those, you should get tested as well. But really the cough and fever, if you chills, aches and pains, if you have those, you really do need to think about getting tested. And if you get tested and your test is negative, you need to make sure that you still stay home until you're feeling better. And if your symptoms don't go away as quickly as you expect they should, or if they seem to worsen, then you should consider getting tested, or at least getting checked to see if you need to get tested again. It's really important. I know people think, that we haven't had very many cases, and we've been very fortunate, I will say that, but, COVID can raise its head anywhere, and so anytime we have these symptoms, you have to think it could be COVID. I'm sure the people involved in this cluster are very surprised to have found out, that they are positive for COVID. So really, I can't stress enough the importance to get tested if you have symptoms and not go to work.
Thank you. Thank you.
Our next questions are from Maud Montembeau from Radio Canada. Please go ahead.
I already asked my question. Thank you.
Thank you, Maud. I will now go back through each reporter to see if you have one final question. Peter Cowan with the CBC, do you have a final question?
Yeah, I'm just wondering, how many total suspected cases do we have right now? You mentioned the one connected to the daycare. I'm just wondering if there are any others.
I'm not sure of the total at the moment. That's, Eastern Health on the ground would know that, but the one is all I know about at the moment.
Thanks. Peter Jackson with the Telegram, do you have a final question?
No, I'm good. Thank you.
Thanks, Peter. Richard Duggan with BOCM, do you have a final question?
Yes, I do. I know that, for example, at my son's daycare, there is an after-school program. At this time, is there any concern that this could wind up in our school system as well?
That's always a concern whenever we have a non-epi-linked case, and it could wind up in our school system even without having a daycare connection. So that's why we're stressing that anyone who has symptoms should get tested, and we want to make sure that we find all the cases that are out there. That's the most important thing. We can only contain COVID if we can find it.
Thank you.
Elizabeth Whitten with All Newfoundland Labrador, do you have a final question?
Yes, I'm wondering if there's been an update on the number of people who have been tested in the province since yesterday's briefing.
We do. I don't have it today, but I'm sure it will be in the advisory that goes out, Elizabeth.
Oh, thanks. Kellyanne Roberts with NTV, do you have a final question?
I do. Mine's in regards to the man that was arrested on the West Coast and has been charged with not self-isolating. We know the RNC officers were self-isolating. Is contact tracing completed in that case?
Yes, to the best of my knowledge, yes. Well, I don't. Well, no, sorry. There's no need for contact tracing in that. Like, we don't do contact tracing unless we have a positive case. So.
Oh, right.
Sorry.
Thank you.
Sorry.
Maud Montembeau from Radio Canada, do you have a final question?
No, thank you. Have a great day.
Thank you. You too.
Thank you, everyone. Dr. Fitzgerald, do you have any final comments today?
Yeah, thanks everyone for joining us. This is concerning news, but we have it within our power to get this under control. So we just want people to make sure that they adhere to public health measures, that if you have symptoms, you get tested and you stay away from other people if you are sick, even if your test is negative. So everybody stay safe, take care.
Thank you, Dr. Fitzgerald. Stay safe, take care of yourselves and each other, and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.